Hi, everyone. Thank you for joining our Primary Care Korea program webinar series. Today, we're going to talk about our Chiropody program. A very warm welcome to all of you. My name is Cherry. I'm the Student Recruitment Coordinator. We're in charge of events, fairs, open house, or any recruitment-related activities. Here with me today is my coworker, Jason, and I'll pass over to Jason to introduce himself.
Thank you, Jerry. So I'm Jason. I'm the Student Recruitment Officer at the Michener Institute. I work closely alongside with Cherry for events. Typically, you'll see us at grad fairs. You'll see us at high school fairs. Might see us doing some presentations as well from time to time, and you might see me on the road. So if we did meet on the road at one point, thanks for coming. But in case you didn't, nice to meet you. And I'm going to pass it back to Cherry so she can kick off our presentation or our
Thanks,
webinar, I should
Jason.
say.
I'd like to start by a land acknowledgement. The sacred land on which the Michener Institute operates has been and continues to be the territory of Huron-Wendat, the Seneca, and the Mississaugas of the Credit River, among many other unnamed and unrecognized indigenous communities. Michener stands on land protected by the Dish with One Spoon Treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. We recognize that this agreement is not a thing of the past, but a promise that we honor today and into the future. We share the responsibility of taking care of this land and transforming our personal and institutional relationships. We acknowledge that this is our collective responsibility to strengthen our ties within the communities we serve and practice healthcare in a way that advances the Truth and Reconciliation Commission's 7 health-related recommendations. So, before we start, I'd like to encourage everyone to just put your questions in the Q&A section instead of the chat so that we can address your questions one by one later. So, what exactly is chiropody? So, chiropody is a specialized field of healthcare focused on assessment, prevention, and treatment of the lower limb, especially the foot or ankle disorders, for instance through medical, surgical, and therapeutic means. Chiropodists play a key role by diagnosing and treating conditions in the lower limb that impact mobility and quality of life. So today we're very lucky to have our student guest speaker, Kiwana, to talk more about the program. So over to you, Kiwana, to introduce yourself and talk more about why you're in the program.
Okay, so my name's Kiwana, as introduced. I'm a second year in the chiropody program, and I'll just answer some of the questions on the screen. So first, like, what does a typical day look like? I mean, one day is really not the same. I feel like talking about an entire week is more reflective because sometimes we'll be online with like 2 days and then 3 days in person. So online, we're learning a lot of like our theory courses, so like pathophysiology regarding diseases, anatomy, podiatric medicine, and we'd be doing that at home. And then when we reach on campus for our labs, that's where we kind of integrate our theory into labs, whether it's learning like our assessments to use on patients, checking blood flow, like nerve function and things like that. And then the third piece, once you get into like your second semester of first year, is you go into clinic. So now it's kind of combining like your theory and your labs on patients and putting it to work in real life. So I know that wasn't really a day, but I think that's just like a good representation of like what a week looks like, just because every day is really different. Um, I will say I kind of have a unique perspective because I'm working at a clinic right now. So I'll just shed some light on like what it might look like as an actual practitioner. So from what I've seen, it's a very chill and easygoing job. Like you come in, your rooms are set up, and you really just see like so many patients with different conditions throughout the day. So they could have like fungal infections, thick nails, pain, just anything that involves the foot and ankle you'll see and treat. So it really keeps you on your toes. So I would say it's really good in school because you're just learning so much. But then in the real world, it's just nice because you get to talk to people, solve problems, and things like that as well. So I'd say that's what like a typical week looks like, and also in the field, which is great. Um, As for my favorite part of the program, I would honestly say it's going to clinic because that's where I put everything I've learned into practice. So I kind of get to sharpen like my clinical decision-making skills by seeing different patients, different conditions, what works with one patient, what doesn't, and then also like working on my skills for diagnosis and investigating because you investigated a problem and then you diagnose it. In terms of what interests me the most about the program, I would say it's mostly like learning about how diseases like diabetes can show up in the foot, but exactly how like the step-by-step process from like high blood sugar leading to like other pathways that can give you nerve problems and altered sensation in the foot. So I really like those concepts and them connecting it or connecting them and then seeing how they show up in an actual patient in front of me. I would say that's like a really cool part of it. And then any admission tips for prospective students? I would say, honestly, worry about what you can change and don't worry about what you can't. Like, depending on where you are, you might be an undergrad. So, if you can still increase your GPA, then do that. If you haven't written Casper, then, do your practice kind of assessments and master like your typing speed because that's really important. And then I would also say don't worry too much because like I've known people who've gotten in with high GPAs but didn't do well on Casper, and people who've like maybe don't have high GPAs but did really well on Casper, or people who have high GPAs and did really well on Casper. So I would say like don't get discouraged, just change what you can and do your best. And I feel like if you make sure you're well-rounded in some way, you'll be okay and just hope for the best.
Thank you, Kiwana. That's very helpful. So not a lot of people know about chiropody or even the profession as a chiropodist. So what made you choose this program in the first place? Could you share more about like why you chose this program and what you know about it before you joined?
Yeah, for sure. So it's actually funny because myself, like a lot of people I know, they didn't really grow up thinking like, oh, I want to treat the foot. It's just kind of something you stumble into and really figure out that you like. So I did a bachelor's of science in biology, and I ended up taking a gap year after my undergrad because I initially wanted to do dentistry, but it was just way too expensive and going into that much debt as a young adult just didn't seem worth it for a job personally. So that's when I kind of started looking at other professions that still allow you to kind of do primary care and have autonomy without like the crazy debt. And that's kind of when I landed on chiropody. And I was like, great, I go from like one end of the body to the next. It's pretty cool and you learn a lot about the foot. So that's kind of how I ended up here. And then before I applied, I honestly didn't know too much aside from the general scope of the job, like some of the conditions you would treat, like athlete's foot, or like fungal infections of the foot, nails. But there's so much more that I learned about while in the program that we can do, which kind of like sealed the deal.
Oh, that's amazing. Thank you so much. So I hope like all of you learned a little bit more about Kiwana and her reasons of choosing the program and her student experience. Now I'll open the floor for a live Q&A session. So if you have any questions, please put your questions in the Q&A section. The first question we have is how many students are accepted from different provinces per admission cycle? So I'll pass it over to Jason to answer those questions.
Awesome. Thank you. Thank you. Yes. So yeah, when it comes to applying at Michener, I will say this. We encourage all applicants to apply, whether you're domestic or international. We welcome you regardless of your status. However, I will say that because we are funded by the Ministry of Health in Ontario, we do prioritize Ontario residents first. But at the same time, I'm not discouraging anyone to apply, but just keep that in mind when you do apply. But yes, we do accept applicants from all provinces. I will say that's and internationally. All right. I did see one in the chat. If you do have any other questions, please put it in the Q&A chat, and I really appreciate that. Um, Shahana said, "Can you discuss more about the application intake for January 2026?" Yeah, for sure. So Most of our programs at Michener, if not all, do have one intake, which is in the fall. However, because of the shortage we have in Ontario and the shortage we have at Michener, we have a special January intake. So essentially, the way this works is you would apply. We extended our deadline actually to the end of November, and essentially you would be starting in January for the winter, and then you have your second semester in the summer, so that would be around May, and then you would basically be on track to graduate with those who started in fall 2025, essentially. It's a unique opportunity, but definitely, if you have completed your undergrad and you're looking to start in January, we encourage you to apply. Next question, I'll go back to the Q&A. What is the format of the program, and do we have summer breaks? Uh, Kiwana, I'm going to pass this one to you.
Fair. Okay, so the format of the program is you have your first year, so you have like a fall semester, September to December, then you have a 1 month break. So kind of like how university is, and then you have like a couple days for like a reading week. And then you go into your winter semester, like how you typically would in undergrad, and you end in April. And then for the first year of the program, you have a summer break, so you do have 4 months off. But second year is honestly where it starts to really ramp up. So instead of getting a summer break, you have a summer semester where it's not like a full course load, but you're still in clinic seeing patients and taking other courses on top. And then the third year is basically all clinical placements. So to my knowledge, it's about 4 7 week blocks. So you're basically summer for 7 weeks. It could be like different environments like private practice, community care, hospitals, and you're treating and seeing patients, and you go to 4 separate places. And then you also have to do like what are called OSCEs, where you just demonstrate that you know your skills.
Thank you. Next one is from Diana and also going to be for you, Kiwana. So the first part of the question is, do you do a lot of surgical procedures throughout the week? And also, what diagnoses do you see the most?
So to answer the first question, I actually haven't done the surgery course yet. So second year, first semester is where you learn how to administer local anesthetic. So you have to learn how to do injections first before you can even move on to surgeries, which is in second semester. And then once you learn to do surgeries in second semester, I believe that's when you take that skill to either the summer or third year and you start applying it. So we actually don't really see many surgeries in second year, although we could be helping with like preparing for the surgery next semester or like maybe the local anesthetic injections. Not too sure on that last part though. In terms of what diagnoses we see the most, if we're talking about like skin, then it's definitely like a lot of fungal infection. So like think athlete's foot, people who are wearing sweaty shoes for a long amount of time, maybe not drying their feet like well after showers. You just kind of create an environment that allows like the fungi on your skin to grow. In terms of nails, same thing, or just like really thick nails due to trauma. When it comes to the pain side of things, like someone comes in with foot pain, by far like plantar fasciitis is something you would see the most, but you're still going to be able to see like a lot of conditions, even in the patients that are coming in for an initial complaint.
Awesome. Thank you. Next one is approximately what is the salary of a chiropodist after graduating from the program? It does vary from what I know. And maybe Kawana, you can also chime in on this. But I believe looking at some salaries on Indeed, we were getting around 130,000. And of course, that depends where you work. That also depends if you decide to open your own practice one day or if you move. But essentially, yeah, you make some good money. And the fact that there is a shortage in Ontario, the job market, job prospects, it's wide open for you.
Yeah, there's definitely a lot of money to be made in the field. And like the beauty about this field is you choose your hustle. So if you only want to work 3 days a week part-time somewhere and still make solid money, you can. But if you want to work like 6 days and really like break 100K, you can do that as well. Or you can open your clinic and even make more. So honestly, kind of sky's your limit. But from what I've seen and spoke to most people, like you're touching at least 100 after graduation for most people.
Yeah, good money right there. Um, so just due to the interest of time, I'd love to get to everyone's question, but because our webinar does end at 6:15, I'm going to answer one more. Someone was asking if you feel comfortable, could you share your GPA and Casper since assessment is CGPA 50% and the Casper test is also 50%? If that's something you want to share, Kawana. If you don't want to share, no worries.
No, that's fair. My GPA going in was about 3.7. So I applied with that. And then for Casper, I got fourth quartile. So yeah, kind of like the best you can get on Casper. But I know people who got second quartile and have like a lower GPA. So don't let anything discourage you, if anything.
Amazing. Thank you so much. And to all that ask questions, I really appreciate your questions. I think Cherry is just answering the last few for me, so I appreciate that. So we just move on to the closing of our presentation. So in case anyone had any additional questions regarding the January intake, September intake, or just in questions in general about Michener or the chiropody program, you can send us an email. It's admissions@michener.ca, and one of our lovely team members will be able to answer any inquiries you have. You can also call us from Tuesday and Thursday. That's when we're on site, and that's from 9 to 12 and also 1 to 3:30. Or we have something called our Ask Me session, ASKMI. So essentially, it's a drop-in session on Zoom from every Friday between 1 and 2, where you get to meet with the recruitment and admissions team, and you can ask those questions virtually. And we also have our other webinars in case you were like, you know what, chiropody is cool, but I want to check out your other ones. Can I still register? Well, the ones we have coming up would be for international students, which is on the 19th of November. And we also have one next Monday for our joint programs with the University of Toronto in medical radiation sciences. However, all of our webinars are recorded and posted on our website at michener.ca. Just navigate to the event section and to information sessions. And we also have our open house that's coming up this Saturday on November 22nd from 10 to 2, and it's going to be at our campus at 222 St. Patrick Street, not too far from St. Patrick subway station on line 1. So if anyone is available, definitely come out, register online at michener.ca, and we get to meet you in person, hopefully. Maybe, hopefully, we'll see. But without further ado, on behalf of myself, on behalf of Cherry and Kawana, we want to thank you very much for joining us this evening. And until then, we'll see you next time. Hopefully, we'll see you in the future and have a wonderful evening. Stay warm, everybody. Bye.
Bye, everyone.
Hey, good
Thank you.
applications.